Okay, perfect. Well, I am just so excited for our conversation today and excited, of course, to have Yusra, who we connected right when we had a chat earlier, right when the pandemic hit, about support systems for moms across Canada and what that looks like. We've come a long way since then, hopefully. But I'm really excited to have you back and just for this mini series, talk about the incredible work and the work that still needs to be done to support moms everywhere as well. So I wanted to welcome you, Yusra Kadir, who's the Vice President of Programs and Advocacy for Mothers Matter Center. And so really thrilled to have you here. So thank you. Um, so I wanted to kickstart this conversation by asking you, because you sent me back 3 years as far as reflection, because we originally connected right when the pandemic hit in 2020. And so I wanted to just take us back a little bit in terms of the work that kickstarted during the pandemic and how things are going now come 2024, hopefully post pandemic in terms of the impact that's being done across Canada as it relates to Mothers Matter.
Thanks so much, Somian. Thanks so much for having me. I'm very pleased to be here and looking forward to our discussion today. And yes, you have set me back 3 years as well. So the pandemic has certainly changed us as people. It has changed households. It has changed communities. It has changed the job market, and it has also changed, the ways of working. So, in a post-pandemic world, and I hope we are in the post-pandemic world, but in the situation that we're in, there's adaptations and there's flexibilities, and we've learned to value them because we were forced to do many of those things because we just couldn't do things the way that we used to do. So I think there's something, alongside the devastating impact of the pandemic to global and national economies and the social impact it's had, there's something to be said about, some good practices and learnings that have emerged as well. So I hope we can, take those positive experiences and make them, more positive and grow them and grow into them. I think if we speak about mothers, particularly vulnerable mothers, and we, as the Mothers Matter Center, we work with partners across Canada, coast to coast to coast, majorly with refugee and newcomer mothers, and then with Indigenous mothers. So it's hard to say how all moms are doing because they are so uniquely and beautifully different and diverse from each other. So, and we're fans of, not one size fitting all because we really want to remain client-centric and adaptable and feasible. But I think things are getting better in terms of activities and routines normalizing within the family, people getting back to work, schools being reopened, children not missing out on not only education but the social piece that comes with going to school, and communities finding the strength in interacting with each other and in those connections. I think there's also something to be said about the resilience of mothers across Canada, across board that we serve. And we always, we tend to get into this colonial savior mindset where we're like, we are supporting the mothers. Like the mothers were absolutely inspirational and amazingly resilient, and they survived and they did what they needed to do to make their families get through the pandemic and get back to normal.
Yeah, it's so interesting to kind of think about everything that unraveled, right? Whether that is loss of jobs, whether that is not having access to mental health supports, or even giving birth, on your own without your own support system, and what it does to a new mom, or when you're coming into Canada, not knowing where your supports lie. There's a lot of different things that have amplified, but certainly, hopefully, there are some, as you mentioned, learnings and unlearnings that have gone on throughout this journey. And I'm very curious to kind of hear your thoughts because oftentimes there is this approach in a way where, and we spoke about this a little bit earlier, where things are very reactive as it relates to building systems to ensure that it is the utmost best support that is being provided to all sorts of moms across. So I wanted to just kind of take us back a little bit, or even perhaps forward, and just curious to learn what missing links, if any, were found kind of in your journey in the work that's being done within the center right when the pandemic hit, but even now. I mean, what were some of the missing links that have been have been exposed or have been witnessed to, and how did it evolve as far as change is concerned?
Mhm. So I want to pick up a little bit on the impacts that you
Yeah.
spoke about, the loss of employment, the transition back into workforce. And I just want to reflect on it a little bit because the families that our partners work with were hard hit because they were often either unemployed, so not able to access many sports, often underemployed, so not earning enough. We know how Canada is faring on the gender wage gap. I don't want to get started on that, but
Let's talk about
also, I just, imagine being a mom who is vulnerable, who is marginalized, doesn't know the systems, doesn't know the language, is coming from a completely different world altogether. And then you're quarantined, and then you're in the house, and you have two, three, four, five children in the house with you on a low income setting. Things were pretty bleak. And we did see an increased demand for mental health supports, not only for mothers in the homes and strategies to deal with and engage children better while they were at home with mothers, but also the need for these mental health supports for frontline staff that was serving them, because our partners, our programs recruit based on unique skills. That's empathy. Like, have you been there, done that? Can you relate with the family? Can you find flexibility? So when we put people like that who are deeply caring and deeply committed into these positions, there's a fine line between maintaining professional boundaries versus getting burnt out just by the emotional and visual stress of everything that you see and hear. And our programs are home visitation based. So it's a huge privilege being in the homes of around 1,700 women each year across the country, but it's also a great responsibility. So some adaptations that we made were that we did not stop our services. And we did sit around a table and say, we're a home visiting program. What happens to that program when there's no home visiting? But we pivoted very quickly and we delivered the programs online. Our partners were amazing, mostly settlement organizations around the country, but we were able to pivot very quickly. We had an over 80% retention rate in the clients, despite life happening. But what we heard was that was a time when clients needed most support in any and every way they can get. And we did provide mental health supports and trainings, whether it be trainings on mental health first aid, whether it be strategies to decompress for the mother, things to do with the children when you're at home, where you don't have to think what to do with the child and you can just pick up a resource and run with it. And that's all available on our website. I think some of the things like remote work or working virtually, it meant a lot for women, mothers who had domestic responsibilities as well. So that's a practice. We are a remote hybrid organization. We've kept it. We have sort of adapted a hybrid version of our program because it's just, we want to use the opportunities technology can facilitate us with, and if it helps us improve access and make things convenient and easier for the mothers, why not? And I think the pandemic has sort of also made us recognize that, the mother or the refugee immigrant woman who came to Canada 20 years ago it's a different woman who's coming now, 20 years later, in terms of digital skills, in terms of how they want to connect and how outreach can be effective. But I just want to throw in here, Soumya, that we also learned that it's not equal. Virtual service, especially to high need and isolated clients, is not the same as the in-person, one-on-one bond that is needed in peer-based interventions. So we've been advocating a lot about keeping it client-centered and flexible. So, everybody gets what they need to succeed and do better.
Yeah, that's just such a wonderful thing, wonderful way to look at it because, in many senses, it was a horrific period for many folks. And there was this panic, right? Of, oh my goodness, what are we going to do? How are we going to, continue to support folks in the way that we need to while supporting ourselves, which oftentimes we forget, to support ourselves to the point that you made about burnout when we're, emotionally invested all of the time, 110% of the time. There's no support system for us at sometimes, right? So it's wonderful to take a step back and really truly reflect and pause and also think about what exactly do we want to continue to implement in the works that we're doing, as you mentioned with the hybrid, because you're totally right, it's not a new concept, right? The idea of working remotely or the idea of working hybrid, but it's the new norm right now. I'm finding a lot of organizations are implementing this exact change, or they're doing hybrid, or they're going 100% remote. To your point of that balance in work and the work life balance and what is needed at most at this time. Um, so I wanted to take a deeper dive, and I'm really interested to learn about what you found in the work that you've been or are doing in reference to the barriers and the gaps that are faced for moms that are in rural versus urban areas. And how have you pivoted, to ensure that, that support system is constant? So yes, I'm really intrigued and curious to hear about that.
Thanks, Soumya. Again, very important, and it takes us towards, inequity and also being client-centered and remaining that way.
Mm,
There's been a lot of refugees and newcomers coming into Canada. We've looked at the revised immigration level plans, and the numbers only increase as the years go by to support the Canadian economy. There's um, there's a big focus from the government to promote immigration and newcomer retention in small centers and rural communities, which is great. But we also need to make sure that there's enough investments made in making sure that they're not left behind when they're there. So I think there's been a lot of priority given to not only client retention in rural and urban areas by service providers as well as the government, but also, there's been a lot of funding surrounding it, and we hope that remains consistent, it continues. There is no denying that there is a lack of services in rural and small centers. So it's not like the same services or not as many service providers, or it's not as diverse. So while a family who comes to, let's say, Vancouver or Toronto could find a translator or a Swiss worker in the school or a settlement worker that speaks their first language, the chances of that happening if you were in Nipawin or Steinbach or in a rural village in Nova Scotia, it's very hard.
mhm.
So I think that's where some of the technology comes in, that how you can use hybrid approaches, how you can still use technology to sustain some sort of connection in some way, how can you make some resources available. But I think it just needs to be, more thoughtful, more flexible investment. I think it is going to be more resources, more reflection on how those resources and services fared, and then tweaks. So I think it's going to be an iterative process for organizations as well as funders going into that. We have experienced that it costs a lot more to do group-based activities in rural and small centers because people can't just hop on a bus, even if something is, a 30-minute bus ride away because there's no bus to ride in. So they need to have a car or they need to take a taxi that costs a lot more than a standard return bus fare that you'd budget for an urban metropolitan center.
Mhm.
So I think so that's why, with the transport, with provision of childcare, I think those are things that we as service providers need to look into and ask for. And there's a huge advocacy piece there. I think donors are susceptible and they do understand that those are the needs, but we also need to be firm on the resources and the capacity needs that are required for effective service delivery, because otherwise the program impacts and outcomes, they are diluted, and we don't want to do that. And we've also sort of seen that communities in rural and small centers, they are big on those communal connections. They want to connect. They want to see other people who are in similar circumstances as them. So for us, it's been advocacy, trying to introduce pieces that can help communities know their surroundings and their local systems a little bit better. I think there's something to be said about holistic service delivery there. So even if there's few service providers, there need to be more, holistic services. So if there's a women's program, maybe adding on a component with a children's program, so it's more accessible to mothers, adding in childcare so that women can participate in other programs. And I think a lot of organizations are doing that. But if we are to see client retention and higher numbers of refugees in smaller centers, we will need to see an increase in the resources there. The coordination within service providers in small centers and rural areas is great, as far as I know from what I have seen, and that's helpful for sure. We have seen mothers, we have an outcomes-based tracking system, and we look at and report at changes at the outcome level, which helps us stay evidence-based. So we did see a lot of mothers being homemakers before the pandemic or even during the pandemic. And when we saw the rise of mental health supports, we're now seeing a trend in more mothers undertaking some sort of part-time work, whether it be formal or informal.
Mhm.
And that's just because they need to survive and feed their families. So I think the challenges that people are facing, even more so in smaller and rural communities, are related to the larger and more complex challenges the country is facing around housing, inflation, and the cost of living.
Yeah, thank you so much for that. There's so many wonderful takeaways from what you'd mentioned, and to your point about, obviously it's evident, it's not the same support systems that are in place in urban versus rural. And one of the ongoing consistent conversations or challenges that are being faced is that there's just prior to, I guess, settling in folks that are coming in to rural communities, there's no infrastructure. For the most part, there isn't the right infrastructure in place, whether that is in relation to a support system for children, a support system for moms, as it relates to, their culture, their identity. And so it's become this space where already, it's a new environment that you have to learn about, to hear about, to figure out how you're going to adopt things in, how you're going to adapt into your new space. And while you're doing that, there's this stress of trying to figure out, okay, well, who do I go to for the supports that I need? And oftentimes, to your point, you need to have the financial stability to even afford the things that you need to use to get to these support systems, right? So there's so many little bumps along the way. But that's not what's being painted, right? And sometimes, even for myself and my family came over, there's this, wonderful, beautiful canvas that's painted when it says, you know what, yes, you have access to XYZ, and this is how it's going to be for you. And then there's the reality of the situation when you come in and you're faced with additional stressors where anxiety sets in, and you're really trying to figure out, how can I ensure that I can be there for my family and ensure that I have the support systems that I need, whether that's as a new mom, as a mom that's moving with their children. There are a lot of things that still are seen as norms, in a way, which shouldn't be a norm when you're trying to figure things out after you come in. It should be something that is um, set in stone or is somewhat settled prior to adapting into your new environment, right? Um, so that's been a very unique, I guess, journey, I have to say, for a lot of folks who are coming in, and especially moms that are, there's this level of distrust, I feel like, sometimes, where it says, oh, but I thought it's going to be so easy to access all these support systems or services, and then to find out it's not as easy. And depending on how the public health system is, what the waiting period looks like, how long does it take to find a GP, what does that look like, how long do I have to travel to, all those little things that add up, right? I'm very interested to hear, in terms of how you found, or your team, or even the work within the center, you found in terms of bringing in that comfort for folks that are coming in, and then who were quickly recognizing that it isn't what it seemed, right? Whether that is the supports that have been promised, or you thought this is what you'd have access to. I'm very curious to hear, how has that experience been, as you're listening to folks talking about their challenges and barriers.
Mhm. So we do serve women coming from over 60 countries around the
Mhm.
world each year. They speak over 80 languages. Just to give you sort of, an idea of the diverse demographic that we work with.
Mhm.
This is very real. People come in, and oftentimes they navigate conflict, they navigate displacement. Sometimes they're camped in different countries before they get to Canada. Sometimes it takes them years. So they're coming with their own emotional baggage when they come to this country, and Canada is the silver lining for them
Yeah.
until they get here. And they get here and they realize that it's not the dreamland that they thought we'd land here and all our troubles will be over. But settlement is a complicated and complex process, because they do not find themselves in the ideal situation that they
Mhm.
expected. So we see that a lot, and our approach to it is just meeting clients where they are at. So if we are running our programs, and our programs are run through a standard curriculum, that means that families need to do 1 week of activities with their child every week. So and when we go into a family's home and they don't have, the child's sick, there's no doctor, there's not enough food in the house. So we don't take the curriculum out and say, hey, we don't care if you're hungry, here's the curriculum, let's
Right.
get rolling. Like, the connection piece is where the home visitor would sit down with the mom would open up, we try and pair up home visitors to moms, especially high need moms, and they're able to speak their first language to sort of assess what the key needs of the families are. And those home visitors make referrals to either
Mhm.
settlement workers or to other services within their agencies. So we take a lot of care which organizations we license to house our hippie and smart programs, because we really want families to be able to access those holistic supports. So a family who needs to go to a doctor first and then learn how to get, a mobile connection and get a social security number gets to go to the doctor first and then do the step
Mm.
2, step 3. While another family who needs to enroll their kids in school first and then find out other community activities, and then access supports for more permanent housing, gets to do their settlement needs in the order that works with their context. So, and we work with the family. So its services are not just for the mothers, but they're also to connect the children and the broader families to service. But our immediate client is the mother, and that's because we believe that when we're able to work with mothers, children thrive and communities prosper. Like that's our overall mission.
Mhm.
I think I think the challenges with the housing and inflation, they have impacted the settlement process a lot, where partners are just unable to find housing for families. We've also seen a lot of loss in parental agency. So families with children who are young or maybe a little bit older, the children learn English very, very quickly, and the roles are reversed. So the parents are left behind in the settlement process, and they're not able to be there and support their kids and advocate for them the way that they ought to be able to. So there's supports for that. We also So the home visitors employed by our programs at the partner sites, and I keep saying partners again and again, I'd love to name all of them. There's 40 plus partners across the country. I can't possibly name everybody, but the the partners recruit the home visitors. There's professional development training available, and the home visitors train, and in 2 to 3 years' time, they transition on to other jobs. Over 50% of the home visitors transition on to other jobs. That's the figure from last year's performance management report. And when the home visitor transitions, one of the mothers in the program takes up employment as the home visitor. So the unique cyclical employment piece helps mothers work part-time, generate some income for their families, gain the Canadian experience, and learn Canadian work culture so they can secure employment. So it's a journey, Soumya, and it's not easy. It takes a lot of time, but we our job is, most simplistically put, is, when we see mothers who say, I can't,
Yeah.
our job is to take them to where they can say, I can. And the victories we celebrate are, the mother went grocery shopping on her own, or the mother was able to take her children to the park, or she rode the bus for the first time by herself. So uh, that's how we do it. Many times it's quite organic, based on families' needs.
Yeah, no, and that's just